Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. I am Dr. Arshad Manzoor, and today we will study the imaging of upper limb. In our regular lectures previously, we have almost done half of the upper limb, probably up to elbow joint, but today we'll do the whole limb, inshallah, and we'll try to cover the whole upper limb in this lecture. So let's start with it. This is the first x-ray you see on your screen, and it is an anterior posterior view of the upper part of the upper limb. And you can see three bones: the clavicle, the scapula, and the upper part of the humerus. Clavicle is the first bone of upper limb, and it has two ends: the sternal end, which is medial, and the lateral end, which is called the acromial end. It is a sort of S-shaped bone, and the middle end or the sternal end articulates with the sternum and forms sternoclavicular joint. This sternoclavicular joint attaches the whole bony skeleton of the upper limb with the rest of the body and the trunk. This is the only bony connection of upper limb with the rest of the body, and other supporting muscle attached to the bones, I mean, they give strength to it, but the bony connection is only this one, the sternoclavicular joint. Laterally, the the lateral end of the clavicle, this forms a joint with the acromion of, this is the acromion of scapula, which is called acromioclavicular joint. It's a cartilaginous joint, and the this this is how the clavicle is attached to the scapula. Scapula is a triangular bone which is on the posterior aspect of the trunk. It has three borders: the medial border, the lateral border, and the superior border. Posteriorly, the scapula has a bony projection which is called the spine. This is the scapular spine, and the scapular spine divides the posterior surface of the scapula into two parts. The upper part is called the supraspinal part, and the lower part is called the infraspinal part. The supraspinal part, here the supraspinatus muscle is attached, and the lower part, the infraspinous part, is the infraspinal muscle. Anteriorly, the surface is smooth, and subscapularis muscle arises from this surface. On the most lateral aspect of this bone, there is a rounded cup-shaped cavity which is called the glenoid cavity. This glenoid cavity articulates with the head of humerus, forming the shoulder joint. Anteriorly, there is another bony projection, this one, which is called coracoid process, and ligaments are attached to this. Right. Let's now we go on to the shoulder joint. Shoulder joint is, as I've already told you, this is found between the glenoid cavity of the scapula and the head of the humerus. This is a ball and socket sort of joint, and it has got great mobility, very important joint of the body. Okay, now we go on to the upper end of the humerus. Upper end of the humerus on AP view, you see this is the head of the humerus, and this is attached with the rest of the shaft, and this line, and this is called the neck of the anatomical neck of the humerus number 2, which attaches the head of the humerus with the rest of the bone. Two bony projections are seen, On the lateral aspect, this one is the greater tuberosity and this is the lesser tuberosity. And this portion of the humerus is called the surgical neck of the humerus. It is called surgical neck of the humerus because most of the time the fractures they are seen at this part. So it is called surgical neck of the humerus. Okay, let's move to the next films. This is again shoulder joint, but this is axial view. How do you take an axial view? Axial view is taken when you place the X-ray. You place the tube, X-ray tube, at the top and put the film below the shoulder joint, and this is the posterior surface. This is the anterior side, and you take an axial view. In axial view, you can see this is glenoid cavity. Now you can actually differentiate between the structures which are present anteriorly and posteriorly. Now, cricoid process, as you saw it on the, it was overlapping. Here you see in the AP view, it was overlapping the rest of the bones, and now you can clearly see it anteriorly. While these bones, this glenoid cavity, and you can see it anterior posterior part of it. So any pathology which is anterior or posterior, you can see, and you can see on this axial view. If any dislocation of the head, if it is dislocated anteriorly or posteriorly, this is very clear on axial view. Anterior posterior dislocations cannot be eh, seen on AP films. Okay, and this is the head. This is glenoid cavity, and this is the head of the humerus forming shoulder joint. And this is the lesser tuberosity. This is the intertubercular groove, and this is the greater tuberosity. This bone, you can see, this is the acromial process of the scapula, and this is the acromion, and you can see the acromial end of clavicle, which is forming acromioclavicular joint, and this joint lies on the superior part aspect of the shoulder joint, and you see these joints are overlapping in this view. While in the previous film, you could see them. This is above this joint. The acromioclavicular joint is lying superior to the shoulder joint, and you can, in AP view, you can see them clearly differentiate them, but on axial view, they overlap each other. Okay, next we go on to the humerus. This is humerus in whole length of the humerus in lateral view. This is the upper end where the head of the humerus articulates with the glenoid cavity of scapula and forming the shoulder joint, and the lower end of humerus, this articulates with the bones of the forearm, which are radius and ulna, and the elbow joint is formed. We see the next X-ray, we see the elbow joint. These are the two views. This is AP view of elbow joint, and this is the lateral view of the elbow joint. The AP view, in AP view, we can see the details of the bones. This is the medial side and this is the lateral side. How to differentiate? This ulna is on medial side and radius is on lateral side. So these are the condyles of humerus at the lower end. These bony projections are called condyles. This is the medial condyle and this is the lateral condyle. The articular surface of the radius is has two parts: the capitulum, which is on lateral side, and it articulates with the head of radius, while on the medial side is the trochlea. This hinge type of surface, this is trochlea, and it articulates with the ulna. In between the two condyles there is a fossa or a deep space which is called the uh, olecranon fossa of the humerus. Here the olecranon process of the ulna. This is the olecranon fossa of the ulna, which rests here in olecranon fossa while when the bone is extended, when the elbow is extended. On lateral view, you can see these condyles overlapping each other, and you can't make out clearly, right? But you can see the surfaces, the articulating surface. This surface is articulating with the ulna. This is trochlea, and this part laterally seen anteriorly, it projects anteriorly, and this articulates with the head of radius, right? This is the head of radius, and this is capitulum. Okay, and then coming on to the next, the other bones of the forearm, the upper end of ulna and radius. This is the head of radius. This is the articular surface which articulates with the humerus, and this this part is the head of radius. This forms in this articulates with ulna, forming the proximal radio-ulnar joint. And the proximal radio-ulnar joint is the joint where supination and pronation movements take place. This is the neck of radius, and then the shaft of radius. This is on medial side is ulna, and this process of ulna, which AP view it is like the bony this portion, and laterally you can see it more clearly, and this is called the olecranon process of ulna. And anteriorly there is a bony projection of the articular surface. This is called the coronoid process, and this is the articular surface of ulna which articulates with trochlea of the humerus. Coming on to the radius, this is on the lateral view. This is the neck of head of radius, and then the neck of radius, and you see this tuberosity on the medial side, medial anterior aspect of radius. It is somewhere here on the AP view, and this is called the radial tuberosity, and biceps muscle is attached to this, and yes, and to this tuberosity. Then we go on to these are the shafts of the two bones, ulna and the radius. To the next X-ray. Yes, these are the bones of the forearm. Actually, the X-ray of the forearm. You can see the two bones and the soft tissues. This is on medial side. This is ulna, and on lateral side, this is radius. These are the shafts of the two bones. Proximally, they form the proximal radio-ulnar joint, and distally the distal radio-ulnar joint. The radio-ulnar joints, the movements of supination pronation, they take place at this proximal radio-ulnar joint. Okay. The lower end of these two bones, they form along with the carpal bones, the wrist joint. Okay, we see the details of wrist joint here. This is an AP view of the wrist joint. This is the radius on lateral side, and medial side this is ulna. This is the articular surface of the radius, and this only projection on the lateral aspect of the radius. This is the styloid process of the radius, and and the ulna also has a bony projection on medial side, and this is called the styloid process of the ulna. This is the articular surface of the two bones, and these are the carpal bones. Carpal bones are 8 in number, and they are arranged in two layers. The proximal layer has 4 bones, and the distal bone layer has 4 bones. The proximal line of the bones includes scaphoid, First is scaphoid, then lunate, then tracheal, and then pisiform. This is 15, pisiform, right? And the distal layer line of the bones is trapezium, then trapezoid, then capitate, and then hamate. So the famous mnemonic which we used to remember, we used when we were students to remember the names of these bones was Sophia Loren, Tinde Pukai, Tinde Tere Kache Hain. Sophia is scaphoid, then lunate, then triquetral, then pisiform, then trapezium, trapezoid, capitate, and hamate. So these are the joint formed between radius and the carpal bones. This is called radiocarpal joint, and ulna and carpal bones is ulnocarpal joint, and the joints in between these carpal bones, these are called the intercarpal joints. Now these carpal bones then articulate with the bones of the palm of the hand, which are called metacarpal bones. They are five in number. First bone is that bone to which the thumb is attached, and then second, third, and fourth, the index finger and the ring finger, and the index finger, middle finger, ring finger, and the little finger. These bones of the palm of the hand, these are called metacarpal bones. Metacarpal bones have the proximal end, they are called the base, and the distal end, they are the head of the metacarpal bones. The bases they articulate with the carpal bones, and they form, these joints are called carpometacarpal joints. Whereas the distal ends of these bones they articulate with the proximal phalanges of the fingers, and these are called metacarpophalangeal joints. The first metacarpophalangeal joint is that of the thumb, and then second, third, fourth, and fifth. This is how we describe them. The first metacarpal joint, second is that of index finger, third is that of middle finger, fourth is that of ring finger, and last one, fifth, is the little finger. Then comes another row of bones which is called the phalanges. These are the bones of the fingers. So each finger has three bones except for the thumb, which has two bones. These bones are called phalanges. The proximal phalanx, the thumb has only two bones, the proximal phalanx and the distal phalanx. Whereas the other four fingers have three bones, the proximal phalanx, the middle phalanx, and the distal phalanx. The joints which are between the proximal and the middle phalanx, they are called proximal interphalangeal joints. These are the proximal interphalangeal joints, and the joints formed between the distal phalanxes and the middle phalanxes, they are called the distal interphalangeal joints. Right? So each phalanx has a base, which is the proximal end, and the head, which is the distal end. Each phalanx has head and the base, right? So these the distal phalanxes, the distal hands are free, and you can see the soft tissues of the hand around these bones. So any swelling of the soft tissue or any abnormality of the soft tissues, this can be noted. These are the small bones. You can see these accessory bones, small bones. These bones are called the sesamoid bones, and these are in the tendons, and these are normally present, and you should not confuse them with the fractures. Okay, so we covered almost whole of the skeleton of the upper limb, and just to summarize the whole thing, these the bones start from the clavicle is the first bone, which articulates with the proximally with the sternum, forming sternoclavicular joint attaches to the rest of the skeleton. The distal end of the clavicle it articulates with the acromion of the scapula, forming a acromioclavicular joint. The acromion, the acromioclavicular joint, the scapula is the bone on the posterior aspect of the trunk of the chest, and it on the lateral side it has a cup-shaped cavity which forms shoulder joint along with the head of humerus. Humerus is the long bone of the arm. Humerus is the long bone of the arm. Proximally, it forms shoulder joint. At the distal end, it forms elbow joint with the bones of the forearm, which are radius and ulna. Radius and ulna, and then at the distal end, they form wrist joint with the carpal bones, the proximal carpal bones, and then the distal carpal bones. The two layers, there are 8 carpal bones. The carpal bones form joint with each other, which are called intercarpal joints, and then with the bones of the palm of the hand, which are the metacarpal bones. And these joints are called the carpometacarpal joints. The metacarpals they form joints with the phalanxes of the fingers and the thumb. These are called the metacarpophalangeal joints. The phalanxes, each finger has 3 phalanxes except for the thumb which has 2 phalanxes. The, the joints between the proximal phalanxes and the middle phalanxes are called the proximal interphalangeal joints, and the joints between the distal phalanxes and the middle phalanxes are called the distal interphalangeal joints. Okay, thank you very much. Next time we'll discuss the lower limb bones. Thank you very much.